玫瑰。
What? My sister has a rare case of dilated cardiomyopathy. It's incurable.
You know this disease.
Doctor, I am a med school grad. I just graduated.
Then you know, dilated cardiomyopathy is chronic incurable only manageable. Your sister is not in danger. She can go home after observation. I'll prescribe some meds. Take them on time.
Thank you, doctor. Claire, get some rest. Don't overdo it.
Ethan, I asked the doctor. My disease is incurable, but if I am careful, it won't affect my life.
Don't worry. I promise. I'll cure you. Get some rest now. Our parents died young. In this world, Claire is my only family. I must find a way to cure Claire.
Congratulations on binding the general medicine system.
General medicine system?
General medicine system, it has 3 levels. Proficient, perfect, master 3 levels. Proficient, perfect, master. As you treat patients, gain experience. When it reaches 100%, it has 3 levels. Proficient, perfect, master. You can level up, reach master level. You can treat all kinds of diseases.
Really? Does that mean I can cure Claire? Tell me now. What level am I now?
You are proficient level, practitioner, as a welcome gift. You are proficient level, as a welcome gift. You get mastery of suturing.
Why do I feel I suddenly know so much clinical medicine, especially suturing, all kinds of suturing, are second nature.
Ethan, come to my office. Let's talk about your postgrad studies. What? You are giving up postgrad studies to work?
Yes, Professor Cole. I don't want to go. I want to work now. Only by working can I treat patients, gain experience, level up the system to master level, and cure Claire.
Why?
My sister has dilated cardiomyopathy. I need the money to treat her.
How could your sister get such a disease?
It is my fault. I didn't notice. So, Professor Cole, could you recommend me?
All right. In 3 days, Central City Medical Center has an interview. I'll recommend you. Central City Medical Center has better facilities. There, you can learn more. Maybe you can learn about her condition.
Thank you, Professor. I'll get going now.
Sure.
Ethan, don't be nervous today.
Don't you know how good I am? As for you, take care at home.
I've been feeling fine. I'll be okay.
All right, stay home and wait for my good news.
Everyone, let me introduce. This handsome young man, his name is Ethan Lin. He has a bachelor's degree. He is my senior, Professor Cole's protégé. My senior speaks highly of him. His medical knowledge is solid. With some training, he'll be a pillar of any department.
He's the top surgeon. Professor Cole's protégé.
Professor Cole's student. Must be excellent.
What was your major?
General medicine. General medicine.
General medicine. People still study this major.
It's too niche. Except for community and rural clinics, there's no job prospect.
Chiefs, let's hear from you. Would you be willing to take Ethan in your department? In order, Chief Young, neurosurgery, you first.
Can you treat stroke patients?
A bit.
My turn's done. Chief White, your turn.
Can you perform surgery?
A bit.
My turn's done. Let's have Chief Liam take a look.
Ultrasound, echocardiogram, MRI, which can you do?
A bit of everything.
Exactly. Jack of all trades, master of none. Esteemed chiefs, with your vast experience, dare you say, you can all read my radiology scans? Neurosurgery, cardiac radiology, a bit of each. Looks like you really are a generalist. A bit of everything, which means you know nothing. I don't care what others say. If you want to join radiology, no way.
Chief Bell, the EDs people. And what we need most are all-rounders. Look at Ethan, handsome, strong, broad medical knowledge. He is the perfect at all-rounder.
Dean,
All right. Since all chiefs are here, I have an announcement. Due to external support, Chief Bell and Chief Bell will rotate. But the job nature is the same.
Code 999! Car crash at the entrance. Major accident. Multiple casualties. All departments. Assemble. Begin rescue.
Move!
Go.
Ethan, what are you waiting for? Follow Chief Bell. From now on, you are part of the ED.
Yes.
Hello? Okay, got it.
Lucy, what's the situation?
2 buses collided. Many people are injured. Luckily they were slow. No critical cases yet. But many patients need urgent suturing.
Understood. Do everything to save them. This is our new doctor, Ethan Lin. He's under your command. I'll check the crowded area.
Can you suture?
Yes.
Over a dozen patients need urgent suturing. Emily Fawn, take him with you. Work with him. Also, get him a lab coat.
Sure. You start with this patient. Suture the leg wound. Ask me if you have any questions. Don't make decisions on your own.
Understood.
Alert a patient has a superficial laceration. Use simple continuous suturing.
It even gives instructions. That makes it easier.
Forceps, 0.9% saline.
Here.
Lidocaine injection. Follow my steps. To treat the patient next to you. Once I finish suturing, I'll help you suture.
What? Are you sure you can do this alone? Without a nurse's help, it is hard for one doctor to handle all this.
Who is the doctor here? Are you questioning my orders? Do it now.
Fine.
My concern is wasted.
Tip, move left 3 mm to insert. Move left 3 mm to insert. Optimal result. Optimal suturing result. Tip, increase tension by 10%. Retract, increase tension by 10%. Wound less likely to scar.
The system's suturing skill is incredible. It is so perfectly done. Alright, buddy. You can go home now. Remember to come back in 5 days to remove the stitches.
What? I can go home right after.
Yes.
Ethan, what is going on? How can you let him go right after suturing?
Exactly. Even the most experienced doctors. Make them wait a few minutes.
I sutured this wound. No need to wait. If you don't believe me, see for yourselves.
Ethan, you're an intern. Ethan, you're an intern. That's the neatest stitch I've seen. Not just neat, it's beautiful. That's perfect. Only a seasoned doctor could stitch this well. You did this?
Of course. Hey, hands up. You can go home now. Why don't you try standing up?
I can stand up.
It doesn't hurt at all. That fast. So I can really go home now.
Really? After the IV, you can go home. Oh, right. Come back in 5 days to remove the stitches.
Okay.
What are you waiting for? We have so many patients to stitch. You, start debridement. I'll handle it.
Right away. Get to work.
How can an intern be this skilled?
Finally done with all the patients.
You've performed 15 sutures. You've performed 15 sutures. Experience plus 50%. Experience plus 50%. Current EXP 50%. 50% more to perfect general medicine. Current EXP 50%. Need 50% more EXP to perfect general medicine.
Got half the experience. Looks like Ed was the right choice.
Bonus cash award.
Bonus cash 5,000 yuan. Bonus cash 5,000 yuan. Deposit it to your bank account. Use it freely. Deposit it to your bank account. Legitimate source. Use it freely.
There's cash, too.
This guy, in an hour and a half, stitched up 15 patients. Even the chief can't do that. Ethan, come report to Dr. Chen with me.
Sure.
Dr. Chen, all patients needing sutures have been treated.
Emily, with your skills, 6 patients is a stretch. Stop slacking off. Get back to work.
I wasn't slacking, but most of the patients were done by Ethan.
What?
If I remember correctly, the patients needing stitches in ER rooms 1 and 2 numbered 20. In 3 hours, even if I did it myself, I couldn't stitch up 20 patients.
Dr. Chen, but he really did it.
I'll check now. I hope today isn't your last day.
Where are the patients? How could you move them without permission? If there's a cross-infection, we're in big trouble.
For the minor cases, their wounds are all stitched up. I discharged them.
Without the attending's approval. You discharged them. Emily Fawn, you didn't know either. Did you ask for my opinion? Do you even respect me as your mentor?
Dr. Chen,
Save it! What about the moderate cases? Don't tell me you discharged them too. Thank goodness. The moderate cases are still here.
Hello? May I ask, what's bothering you today?
Not at all. Perfect. Thank you, Dr. Lin. Earlier, the pain almost made me faint. After Dr. Lin bandaged it, I feel like nothing happened.
Look! Please calm down. You don't feel pain because the anesthetic is still working. To be discharged, we need to make sure it won't get infected. Come, let me check it again.
You're the boss, right? Check me out. I want to get out of here.
even continuous horizontal mattress sutures. The knots are so neatly buried. Perfect tension. What exquisite suturing. Not even me in the entire hospital. Only the dean could do this.
Less than 10 minutes to finish this patch. Dr. Lin's stitching is simply amazing. Even my wife's hams aren't this neat.
What did you say, less than 10 minutes? Did you misread the time?
Dr. Lin, you be the judge. How could I misread the time? Even with the nurse's prep, it was under 10 minutes. I checked the time. Don't believe me. Ask the other patients.
That's right, Doc. That young guy in your department really has magic hands. All of us who needed stitches didn't have a single one take over 10 minutes.
So young. How could he have such incredible suturing skills? It is impossible.
Lucy, you have surgery. Go to the OR. I'll handle this.
Understood, Chief.
Dr. Chen's suturing just keeps getting better.
Dr. Chen, it was Dr. Lin who stitched me up. That Dr. Chen who just left had nothing to do with it.
What? You mean him?
What? It was him?
Who else?
Just as expected, from Professor Cole's Pratigor. Looks like our ED really struck gold.
Ethan, I have something to do. I am heading out. Go to Chief Bell's office.
Sure.
Ethan, be honest with me. Besides suturing, what else are you good at?
Suturing is just the basic stuff. Clinics, surgery, medicine, surgery, even traditional medicine. I know a thing or two.
Good man. For now, team up with Dr. Fawn. You'll be in charge of triage.
Thank you, Chief. I won't let you down.
Go ahead.
Sure.
Dr. Fawn, what's for dinner?
What do you feel like?
I feel like...
What's going on? What's wrong?
Alert! Patient has acute appendiceal perforation. Patient has acute appendiceal perforation. Abdominal compression can relieve pain. Abdominal compression relieves pain. Alert to press 2 centimeters to the right. Minimizes patient's pain. Press 2 centimeters right to minimize pain.
Acute appendiceal perforation. Needs immediate surgery? Quick!
What is the patient's condition?
Alert! Patient has adhesive intestinal obstruction.
Patient has acute appendiceal perforation with adhesive intestinal obstruction. Emergency surgery is needed now.
From general surgery?
No, Dr. Chen. She was just waiting outside when it happened.
You mean this just happened to the patient? Did you run any tests? And how did you determine the patient's abdominal pain is due to appendicitis infection complicated by adhesive obstruction?
Look, abdominal distension. It is already board-like. Slow, stagnant pulse. Breath smells putrid. All signs point to the patient having severe appendiceal perforation. She needs surgery now.
What kind of diagnosis is this? Emily, get an abdominal ultrasound. ECG. Monitor her response.
Yes.
Stop it! I don't care what you studied. You should know. You can't press on appendicitis. It only makes it worse.
Dr. Chen, can't let go. If I do, she might faint from the pain. Appendicitis patients can be pressed hard, but the system actually gave such a counterintuitive tip.
You know, I am your superior. Let go now, or else. Get out of my org.
Fine.
It hurts!
Dr. Chen, the patient's heart rate is unstable. She could go into shock at any moment.
Administer epinephrine.
I got this.
Only the legendary acupressure could achieve such a miraculous pain relief. That is so unscientific.
What are you waiting for? Resume the surgery!
Dr. Chen, based on the ultrasound, blood work, and all other tests, the chance of a perforated appendix is over 90%.
Prep for surgery. Emily Fawn, you are my first assist. Ethan Lin, go to triage and get back to work.
I was the one who admitted her. Not first assist. Second assist is fine.
Alert, patient has cat triple vessel disease. Intra-op risk exists.
Wait, we can't operate yet.
What? No.
Dr. Chen, to be safe, let's do a coronary CTA first.
Coronary CTA? Do you even know what you're saying? Only patients with triple vessel disease need to undergo coronary CTA. She's in critical condition. Doing the scan will only cause more pain.
I know it'll take time, but given her insufficient blood supply, if we skip this, she might not make it off the table.
He was right before. Could he be right again?
Start the coronary CTA now. Also, get the Heart Institute for a consult.
Yes!
Patient, she does have triple vessel disease. My recommendation is to schedule PCI or bypass surgery, but I am not sure if her appendiceal perforation can be effectively contained.
Ethan was right again.
Also, Dr. Chen, how did you know she might have triple vessel disease? Normally, before an appendectomy, there's no need for a CTA.
No offense, but I think Dr. Chen's bold attempt for our surgical pre-op checks, it is a great example. I think we should suggest adding this technique to our surgical protocol. Even for small cases, like appendectomies, if we can know in advance the patient has triple vessel disease risks, then, during surgery, the risk of fatality should be much lower.
Ethan Lin really knows his stuff. During the surgery, I'll have him in the OR.
I have two options. First, the appendectomy can't wait. While I am operating, I wonder if Dr. Strong could ensure the patient's heart stays safe. Second, we do both surgeries at once, but I am not sure if the patient's heart can handle it.
The first option is safest, but on one condition. Dr. Chen, you must operate as quickly as possible. That way, the patient's heart won't be overburdened. Once the heart stabilizes, we'll go to the Heart Institute for the intervention.
Understood. Prep for surgery. Don't worry about the speed. But the patient's heart will need you to monitor it closely.
No problem. My pleasure.
All right.
Ethan Lin, to OR now.
Without a skilled assistant to help me, I am afraid I can't speed up.
Emily Fong, step down. Ethan Lin is my assistant.
Ethan Lin is first assistant.
Dr. Chen, Ethan is just a general practitioner. He's an intern who's never held a scalpel.
Don't worry. I have my reasons. Ethan Lin, you have one chance. If you make it, you'll be my first assistant. If you fail in my ER, you'll only be a triage nurse.
Don't worry, Dr. Chen. In this OR, if I can't do it, no one can.
Oh no! The patient's cecum has a 2-centimeter tear!
You just had to show off. Now you are in trouble.
Dr. Fawn, prepare suction. Start purse string suture.
Can you finish in 2 minutes?
Don't worry, Dr. Chen. 1 minute tops.
1 minute. That's absolutely ridiculous. Even the world's top surgeon, Professor James, could never do it in under a minute.
Tip. Move right 2 millimeters to puncture. Tip. Increase tension by 10%. Increase tension by 10%. Wound less likely to bleed.
Impossible. Absolutely impossible. So young, yet such masterful suturing. It is impossible.
Mission accomplished. Suture complete.
In under a minute, he finished the suture. What kind of sorcery is this?
Well done, Ethan. You finish the suturing.
Sure.
First time as surgical assistant. Experience plus 10%. Work experience. Current 60% experience. Need 40% more. General medicine. Perfect.
Dr. Lin, I sincerely apologize for my rudeness. Also, I'd like to invite you to the Heart Institute. Your suturing is truly masterful. It belongs here, not in ER.
Dr. Strong, I am an ER doctor now. Why go to the Heart Institute? Besides, didn't you look down on me yesterday?
Dr. Lin, I think there has been some kind of misunderstanding. However, I still want to say think it over. Our Heart Institute benefits and top surgeon colleagues, whether immediate benefits or future prospects. Our Heart Institute has it all.
Sorry. I am a general practitioner, not cut out for surgery.
Dr. Lin?
Dr. Strong, if you keep harassing my student, I'll report this to the dean right away. Ethan, come to my office. 2-day surgery report. Needs our input.
Lucy Chen keeping such talent in the ER is a waste of resources.
Dr. Lin was so cool. That is the kind of a doctor we should be. From now on, Dr. Lin is my hero. Ethan, great job today. From now on, you are my first assistant.
Yes, Dr. Chen.
First day here, and you've done so much. You are done now. Go home. Report tomorrow officially.
Okay, Dr. Chen. You are busy. I'll head out.
Sure.
Ethan, how was the interview? Did you get it?
Starting tomorrow. Your brother is. Central City. ER doctor.
That's awesome. I knew it. You're the best man ever.
Of course. Look what I brought you. Fried chicken, burger, cola, all your favorites.
Ethan, you just graduated. Don't waste money.
Just this much? I can afford it.
Ethan, you're trending!
Ethan, you are trending.
What?
Ethan, you are amazing. In just a moment, you finished it. Check the comments.
Med student here. He must be the invincible. With a single needle, he dominates the art.
I am a doctor. There is no way to suture that fast. It is definitely sped up. So fake.
I am a hand model. My hand was injured tomorrow. I'll go to have him suture it.
Ethan, people are coming to see you.
Claire.
They're just talking nonsense. Don't take it seriously. Come on. Let's eat.
Hey, Ethan, tomorrow, you'll be heading to Central City Medical Center.
Yeah. Start tomorrow.
Then I wish you to become the best doctor there.
Of course. Your brother will make it happen. And your illness. I'll cure it.
Eat up.
Here. Let me help you with the straw.
From now on, you are part of our emergency department. Do your best.
I will, Dr. Chen.
Ethan, go to the triage desk now. A woman came in. She is demanding you resuture her wound. If you don't go now, she'll report this to the admin.
Resuture? The wound you sutured yesterday, is there a problem?
Impossible. My sutures could never cause repeated inflammation.
Let's go. Let's check it out.
Dr. Li! Finally you're here. The nurses here are out of line. They wouldn't let me see you. As a patient, I demand a restitch. Is that too much?
Hello. Are you sure your wound was treated here?
Are you Ethan Lin? Are you an ER doctor? If yes, you have to restitch me today.
Hello, miss. Let's go inside and talk. Just a rest stitch, right? I am Ethan's mentor. If you like, I can rest stitch it for you.
Fine, let's go.
Miss, can I take a look at your wound now?
Number. Dr. Lin has to do it.
Ethan, you check her out.
Dr. Chen, take a look.
This stitching style isn't like yours. Not Emily either. She is not that skilled. Wait a sec. This stitching, this is absorbable suture.
Alert! The sutures on the patient's hand are from a plastic surgery clinic.
This is plastic surgery cosmetic stitching. I didn't do this.
Miss, you got this stitched at a plastic clinic. Coming to us isn't right. I don't care what your goal is. Leave now.
Oh no! Dr. Lin's eyes are so sharp, he can even tell it is plastic stitching.
Are you even a doctor? Kick me out! Who gave you the right? Is this your home? I'll sue you. If the hospital ignores this, I'll report this to the Health Bureau.
Sue me wherever you want, as long as I am here. I won't accept such a troublemaker.
Calm down, relax. Dr. Chen didn't mean that.
Dr. Chen, please calm down. There are patients outside. I'll handle this simple suture.
If she gets kicked out, how can I gain experience?
Why should we stitch her up? We didn't treat her in the first place.
You're a heartless doctor.
Alert! Patient shows signs of mild tetanus. Without treatment, it could erupt anytime.
Enough. Stop arguing. You have mild tetanus symptoms. You must cooperate with the tests, or else your life is at risk.
Tetanus! That is no joke. She has tetanus. Her life is at risk. I'll draw blood. You continue.
Doctor, don't scare me. How could it be tetanus?
It is. Not fatal yet. But you must follow my orders. Don't hide anything. We need to find the cause and control it to be safe.
Dr. Lin, just ask. I'll tell you everything.
How did you get this wound? Be specific.
I am a hand model. Yesterday, at a jewelry show, when I took off the bracelet, I accidentally cut my hand. The organizer took me to a plastic surgery clinic. The doctor said, my wound just needed a simple stitch.
Then?
They said the scar needs 3 months. But it costs over 10 grand a month. How could I afford that? Later, I saw your video online. So I came.
I think I remember. Did you comment on my video saying you'd come, right?
Dr. Lin, you saw it?
Miss, you should go to a proper hospital. Only caring about looks, ignoring your health. That is no joke.
I am sorry. I know I was wrong.
I'll remove the stitches. While checking the wound, we'll clean it again. If you feel a little pain, just bear with it.
Dr. Chen, look. The basal layer, down to the dermis, is already showing obvious inflammation. I suspect, when the bracelet cut her, tiny metal fragments remained. That's why the patient, possible mild tetanus.
Metal fragments left in the wound could cause tetanus. But the wound is festering, inflamed. These are common symptoms. Based on these common symptoms, how can you be sure? It is definitely tetanus.
Uncontrolled facial muscles. Mild spasms, agitation, irritability. I don't think she even realized her anger, just now, was way beyond her usual self.
Dr. Lin is right. I am not usually like this. Just now, I don't know what happened.
Dr. Chen, the report. White blood cell count, neutrophil count, and C-reactive protein are all slightly elevated. The chance of tetanus is very high. Give the patient a tetanus skin test. Watch for reactions.
Okay.
Dr. Chen, the patient's tetanus skin test is weakly positive.
Based on the blood work, it's safe to diagnose mild tetanus. Now that we've confirmed it's mild tetanus, Ethan, what's your take on the next steps?
At this stage, I don't think she needs to be hospitalized. Just take the right dose daily of penicillin V, metronidazole, amoxicillin, and ibuprofen. She should be fully recovered in a week.
Good. She's all yours.
Okay.
Also, remember what I said, come back in 5 days.
Okay. Thank you, Dr. Lin. I got it.
Practitioner completed a consultation. Practitioner completed a consultation. Experience plus 10%. Experience plus 10%. Current experience, 70%. 30% more experience. Practitioner completed a consultation. Experience plus 10%. Current experience, 70%. 30% more to perfect general medicine. To perfect general medicine. Bonus skill. Manual hemostasis.
A new skill. Does that mean I'll gain experience faster?
Hurry! Ethan, come with me. There is a long line again.
Alright, let's go.
Dr. Lin is here! Line up! Watch it!
Dr. Lin is very efficient.
Dr. Lin is young, but he is the miracle doctor here. They say he cured cancer.
Just a trended online, and now it is a legend.
Ethan, they're all here for you. You take the lead. I'll assist you.
Move! I am first! Dr. Lin, my chest. Since I woke up this morning, it has been killing me. Right here! Feel it. Is it breast cancer? Many women my age have this disease.
Ma'am, no need for that. Let me check your pulse.
Alert patient's chest. Long-term hard object pressure, mild muscle contusion.
Ma'am, did you have something hard ... in your bed last night?
Dr. Lin, how did you know? My son was looking for his toy car all night last night. When I woke up this morning, I found it. His toy car was in my bed.
Your son?
Yeah, he is 6 years old. Everyone adores him. He is so handsome, just like you, Dr. Lin.
Ma'am, it's possible that while you were sleeping, your son's toy car pressed on your chest, causing a slight soft tissue bruise. Go buy some Yunnan Bayao. Rub it on your chest. You'll be fine in a day or two.
Rub it? How do I do that? Dr. Lin, could you show me how?
It doesn't matter. Any way works.
Okay then. Thank you, Dr. Lin.
Pulse diagnosis completed. EXP increased by 10%. Current EXP, 80%. Need 20% more EXP to reach perfection.
Next.
Me? Ethan, hand over to Emily. Come with me. Now.
Sure. Dr. Chen, what is going on?
Emergency got a call from fire rescue. Construction site. A worker fell from height, impaled by steel bars. No doctors on site to guide them. Firefighters dare not cut. You are a man. Taking you is more convenient. When we get there, stay calm. Follow my orders.
Understood, Dr. Chen.
Let's go.
What do we do? It is so bad. What do we do?
The doctors are here. Move! Doctor, the priority now is cutting the steel bars. You must immediately provide a cutting plan. I am afraid the patient can't hold on.
Check the wound, then decide. The bar through the chest is closest to the heart and artery. To be safe, cut this one first.
Everyone, stand back. Start cutting now.
Alert, the leg rebar has slightly damaged the femoral artery. Slight damage. To femoral artery must remove within 10 minutes. Or artery burst. Patient will die from bleeding. Must remove in 10 minutes. Other rebars are not priority to cut. Or artery burst. Patient will die from bleeding. Other rebars not priority to cut.
Wait. Don't cut this one.
What is wrong, Ethan? Is something wrong?
Dr. Chen, you might not have noticed, right? When you made the call, his wound has changed. Look around the rebar. The blood seeping out changed from dark red to bright red. I suspect his femoral artery could rupture at any moment, so we must act immediately and cut this rebar first. In this case, if the artery bursts, we can't stop the bleeding.
Right now. If it bursts, Not only the leg is gone, the patient's life might not be saved. Are you sure about this?
I am absolutely sure. Within 10 minutes, if we don't cut this rebar, his femoral artery will definitely burst. Dr. Chen, what are you waiting for?
Every second counts, yet I am still hesitating.
Firefighter! Cut the rebar in his leg first. Cutting time within 10 minutes. When cutting, keep the rebar steady. Avoid secondary injury.
Didn't you say, cut the chest rebar first? Why the leg now?
Exactly. Unbelievable. Didn't they say cut that part first?
This is ridiculous! Leg or life! Doctor, can't you tell?
These doctors are so young, Bill. He is done for.
What are you waiting for? Cut it now!
Oh no! Tourniquet!
Alert femoral artery rupture. Patient's femoral artery. Apply manual hemostasis. Vessel repair in 5 minutes.
Don't stop! Keep cutting! Faster!
Help him! If he keeps bleeding, Bill's gonna die! With a doctor like this, he is so unreliable. We're so out of luck.
When you go to the hospital, you gotta see the experts. Young doctors are so unreliable.
Move!
Dr. Chen, stabilize his thigh.
What are you doing?
It is over. Forget saving his leg. He won't make it.
Alert! Cut 5 millimeters to the right. Minimizes patient trauma.
Scalpel. Dr. Chen, prep the needle. We're repairing the vessel.
Okay.
My newly acquired manual hemostasis technique finally comes in handy.
He stopped the bleeding manually. How is that possible? No one could possibly stop an arterial bleed without any tools, just by hand.
Wow. He knows the legendary pressure points. That doctor is a beast. That doctor's got skills. Look at those stitches. Better than a girl's work.
We really misjudged him. Did this doctor wait for this moment?
Need a hand. Within 5 minutes. If we can't reconnect the vessels, he could lose his leg.
No need. I work better alone.
Doctor, please save Bill's leg. If he loses it, he'd rather be dead. Yeah, Bill supports his whole family. Without his leg, his family's done for.
Buddy, take it easy. Just cooperate with us. And not only will I save your leg, you'll be back on your feet. Dr. Chan, prep for debridement.
Debridement done.
Bandage him up.
He has got skills. Incredible.
Next, which rebar first?
Either is fine. The remaining rebar, cut above and below. The parts inside will be removed surgically. Start with the chest rebar.
Got it. Cut the chest rebar.
Dr. Chen, why don't you head back? I'd like to talk to William's coworkers to find out more.
Sure. Come back soon.
Everyone, I'd like to ask you about William's deal.
I am the foreman here. Ask me.
Normally, William is an experienced worker. How could something like this happen?
Don't ask. Bill worked the night shift. This morning, he was supposed to rest. But this morning the boss said, during the rush all workers get double pay. Bill wanted to earn more for his family. So he kept working. Didn't even eat breakfast. Probably too tired. Didn't secure his harness. From the scaffolding, he fell down.
Okay, I see. Thank you. I'll get going.
Ethan, this surgery needs cardio, general, ortho, and other departments. After the consultation, I'll let you know the results. If other departments lead, you might not get to scrub in.
I know, Dr. Chen. I know. Maybe I'm not qualified. I won't make it hard for you.
Thanks for understanding. Go find Emily Fawn. See if she needs help.
Sure. After all, I am just an ear doctor. For this case, at least a chief or associate chief to join the consultation. I can't even watch.
Ethan, let me treat you to lunch. Order whatever you want.
Thanks.
Let's go.
Well?
Chief and Dr. Chen are both in surgery. Air will be swamped this afternoon. You need to eat to have energy to work.
Tell me, you got a favor to ask?
But since you asked, I'll reluctantly ask a favor.
Sure. Just say it. We're friends.
Okay. Can you teach me your suturing? I want to be like you, fast and perfect.
Well.
Why?
It is not that I won't. I just don't have the right. We're both residents. Taking you as my student isn't proper.
You think I am not qualified?
That is not what I meant. I meant I am not qualified. Besides, I have so much on my plate. I don't have time to teach you.
You are looking down on me! Pay for yourself!
Looking down on her? Make me pay. Nowadays, to girls. Always think like this. Look at her. What a waste of food. All right. I forgot. How did Dr. Chen's case go?
Forget it. We should remove the chest rebar first. If it damages the heart, the patient could die. Fatal danger.
Let's remove the spleen rebar first. Internal bleeding is also fatal.
The clavicle rebar if not removed. We can't open the chest or abdomen.
So many chiefs, yet not as bold as a resident. If Ethan were here, would the patient already be in surgery?
Everyone, can I give it a try?
You try. Lucy, what do you mean? Do you even respect us? All these experts can't decide. What makes you think you can brag here? If anything happens, can you take the blame?
Of course I can. Let me do the surgery. Any issues with the patient, I'll take full responsibility.
This isn't the time to be impulsive. The patient's condition is critical. We can't do any useful tests. Given the situation, no doctor can be responsible for this patient's life. Besides, how can you possibly perform such a complex surgery?
Professor Strong, you just joined us, so you don't know. If Dr. Chen wants to do it, let her do it. Before you came here, Dr. Chen was our top cardiothoracic surgeon.
But this is clearly...
Here is what we'll do. Since Dr. Chen is so confident, let her do it. You'll lead. This surgery.
Everyone, let's stay in the observation room. Going into the OR will only distract Dr. Lucy.
Abdomen first or chest first? If only Ethan were here.
Get Ethan Ling and Emily Fong. Or stat.
Everyone, listen up. At our hospital, to train the next generation,
Chief Bell, you're so kind. You shamelessly begged us to act with you for your ED, to train good doctors. We even put our faces on the line. Now you're scolding us? Is there any justice?
I had no choice. Look at you all, acting like soap opera stars. I almost bought it. Look, the surgery's starting.
I know Emily Fong. Professor Fong's daughter. She's very skilled. But who's Ethan Lin?
Lucy Chen seems to trust these two a lot.
Yesterday morning, interviewed in the meeting room, that Ethan Lin, the general practitioner.
General practitioner?
General practitioner? For such a critical surgery, what is a GP doing in there? Chief Bell, Are you kidding me?
Chief Bell, are you crazy?
How can? He'd be in the OR. What if something goes wrong? Even if you're short-staffed, you can't be reckless.
Exactly.
Listen up. You're all biased against him. Who says? GPs can't pick up a scalpel. In my view, as long as you're skilled and competent, right? We should be open-minded about new talent.
Fine. It is your ed surgery. Do as you like. But, if it fails, don't expect us to clean up your mess.
Look. The surgery's starting.
That is odd. Besides Dr. Chen herself, why can't I see other surgeons?
What are you waiting for? Come help, Ethan. First assist. Emily, second assist.
Yes.
Are you ready?
Dr. Chen, during the rescue, we already confirmed this is the fatal rebar. This one. Shall we start with this one?
All right. Start with this one.
One centimeter down. 11 centimeter incision. This gives us better visibility.
So precise.
Absolutely perfect. Just with this cut, Lucy Chen lives up to her reputation. Well deserved.
But why did she pause? Was it calculated or just instinct? Either way, comma ... in general surgery. This is textbook perfect.
Should I remove the spleen? Or try to suture it?
Ligate the splenic artery. Incise the spleen. As quickly as possible. Remove the rebar. I'll handle the splenic suturing. I'll make sure Bill's spleen is fully restored.
Just do it. Why hesitate?
She should be mobilizing the spleen, then ligate the splenic pedicle, and remove the spleen. What is Lucy doing? Cutting the spleen? Is she trying to save the spleen?
Saving the spleen depends on the case. Under normal circumstances, patients can strongly request to save the spleen, but clearly this is not the case.
There's a rod in the spleen, but there are 3 more rods. Those 3 are the fatal ones. Compared to the spleen, it's a waste of time. Isn't this putting the cart before the horse? It's not.
I can say with certainty ... in general surgery. Out of 10 spleens, at least 9.9 are removed. A poorly repaired spleen will lead to complications and require removal, unless...
Unless what? Nick, go on.
Chief Bell, here's the thing. Only a true master of suturing techniques can save the spleen. The chance is slim. To my knowledge, in our hospital, we don't have such talent.
Ethan, ready. On my count. Pull the rod out. 2, 3. Suture now.
This is madness. No way. I have to stop this. At such a critical moment, trusting the suturing to a general practitioner. Is this a joke?
Nick, wait, calm down. Ethan is in my department. His specialty is suturing. With him here, he is as good as Lucy.
No! Chief Bell! This is no time to be fooling around! It worked!
What's this suturing technique? Is he really a general practitioner? Even top surgeons can't match his speed. Besides, it's so precise. This guy, during the appendectomy, he wasn't even giving it his all.
Impressive. Chief Bell, let's talk. Transfer Ethan to our department. Name your terms. I promise to meet all your needs.
No. Chief Bell. Don't listen to him. Watch out for his bribes. He'll corrupt you. A talent like Ethan. If he goes, it has to be general surgery. Our surgeries are more complex. Doctors like Ethan, of his caliber, his skills can only be fully utilized in our department. Chief Bell, just name it. Any terms. General surgery will meet them.
No. Cardiothoracic, general surgery. Orthopedics needs him. Our department needs Ethan with his suturing skills. If he comes, I'll step down as chief. Even serve him tea. No problem. Orthopedics needs him. He is coming to cardiothoracic. Why? Orthopedics needs him. Why? Ethan is ours.
Enough! Everyone out! This is unacceptable. As long as Ethan is in my department, forget it!
Practitioner completed a suture. Current ESP, 90%. Need 10% more XP to master general medicine.
Mission accomplished. Bill's spleen, I saved.
BP is back to normal, but heart rate is dropping.
Light pen. Heart rate normal. Pulmonary artery normal. No signs of massive pleural effusion. Why is the monitor beeping non-stop? If this continues, the patient could go into shock or cardiac arrest.
Could it be the 2 steel bars through the clavicle are causing issues? That can't be. There's nothing wrong. What do we do?
What's going on? System, give me a hint.
Oh no. If this continues, we're in big trouble. Experts, everyone, I am begging you, stop standing around. Go help them now.
Move! Stand back! Something's off. The chest condition is stable. No signs of critical deterioration. Chief Liam, what do you think?
You are the imaging expert. From what I see, the cause of this is definitely not in the heart or lungs.
Let me check. The clavicle wound isn't infected. Compared to previous scans, there's nothing abnormal.
Spleen suturing speed, closing speed, were they too fast? Any foreign objects inside? Should we reopen the abdomen?
If we reopen the abdomen, it will cause serious secondary damage. That's too risky.
Chief Bell, do it. We're out of time. If we wait, we might lose him.
Yes! Chief Bell, don't hesitate!
Alert! Patient has long-term malnutrition. Patient has severe long-term malnutrition, causing blood sugar to drop rapidly, causing blood sugar crash. Threat-threatening life. Life-threatening.
Let's prep. Wait a sec. I think I know the cause. He is starving. Need glucose injection.
I am done. Let me ask you this. What the hell is in your heads? How dare you say such a ridiculous diagnosis? This is about a life. You can't just make it up.
I am not lying. I am telling the truth.
Chief Bell, I have reason to suspect your emergency docs during the suturing, due to carelessness, wound cleaning, disinfection, and the whole unprofessional process. That's why the patient has a massive infection with severe consequences. Given this, even if the critical suture needle was left in the patient's vessel, I wouldn't be surprised.
I stake my reputation that during Ethan's surgery, nothing was left inside.
Your word means nothing. Everyone, I strongly suggest we open the abdomen now for inspection. We're absolutely certain the problem is here.
I agree with Chief White. Start the chest exam now. The patient's condition can't wait any longer.
Intra-op starvation caused blood sugar and heart rate to plummet. Something like this is rarely heard of worldwide.
Dr. Chen, do you trust me?
I do. If I didn't trust you, I wouldn't have let you on my OR table.
Dr. Chen, if you trust me, get a glucometer. Just check his blood sugar. You'll see.
Ethan, Emily, whatever it takes, stop anyone from approaching him. I'll get the glucometer.
Stop! You're gambling with the patient's life.
Move! Dr. Chen is the lead surgeon! What she says! I must follow. Move!
Drop the scalpel! Are all of you insane? How dare you? How can you point a scalpel at a colleague? I'll report this to the hospital. You violent doctors must be fired!
Emily Fawn, drop the scalpel. What are you doing? Are you rebelling?
Who knew Dr. Fawn is so tough?
Dr. Fawn, let's talk it out. Put the scalpel down.
Emily Fawn, what are you doing? Stop anyone from approaching, not kill them! I was afraid they'd move him!
Lucy Chen, you better move. His heart rate and blood pressure have dropped to critical levels. He could crash any second.
If anything happens to him, you and your student will be fully responsible. Move now. There's still time. If the patient crashes on the table, this is murder.
Exactly. Dr. Lucy, ruling out possibilities will help us all diagnose more accurately.
Lucy, what are you doing? I will not allow this nonsense. If this continues, you'll disgrace our department, I am begging you. Let me retire in peace. Won't listen, huh? Fine. As your department chief, I order you, get out of the OR now. From now on, you're no longer the lead surgeon. Move.
Should have done this sooner. Arguing with an attending was such a waste. I think the emergency department needs a cleanup.
Blood sugar 2.0! Ethan was right! He is just starving! Open your eyes! Blood sugar 2.0! Emily! Give him glucose now! Yes!
2 Liu? That's impossible. According to the chart, his pre-op blood sugar was clearly 2.8. Even if it's a bit low, it's still within normal range. Blood sugar dropping during surgery? I've never heard of it. A normal person with 2.0 would almost faint. How could the patient with such severe injury?
General medicine is amazing. He even noticed this.
Ethan, why don't you tell us your reasoning? How could low blood sugar cause blood pressure and cardiac arrest?
Before the surgery, his blood sugar was normal. So during the surgery, there shouldn't be any blood sugar drop. That's what most doctors think. But often, they aren't always right. William Steele on the table is the best proof. I remember a famous saying, experience can be deadly.
Then tell us your diagnosis, so that we, ordinary doctors, with ordinary experience, can learn from you.
I asked William's foreman before, to save more money for his family. He's been scrimping, so he's been malnourished. But he worked 24 hours straight yesterday. Plus, he skipped breakfast and went straight to high-altitude work. That's why during surgery, his body activated self-preservation, drained his body of its last energy. Hence the blood sugar drop and the cardiac arrest. That makes sense.
Yeah, before surgery, interviewing the family can't be taken lightly. Dr. Lin is so meticulous. It seems we could all learn from him. Look, blood pressure and heart rate are slowly recovering.
Heart rate and blood pressure are back to normal range.
All right, everyone. Let's get started now. The patient can't wait any longer.
With Dr. Chen and the general practitioner in your department. Why would you need us?
Hey, Chief Bell, don't look at me, removing that rebar from the chest. I promise, I am not as skilled as Dr. Chen. I've got plenty of patients to attend to. I'll get going.
Orthopedics is here to assist. Whatever Dr. Chen says, we'll follow.
Didn't Chief Bell just say he'd kick me out? I am not the lead surgeon now.
Dr. Chen, Dr. Lucy, I was wrong. Please forgive me. You're still the lead surgeon.
I am begging you to. My chief, don't pull this again. Scalpel.
What was supposed to be 5 hours took just 2. Incredible.
Thank Ethan. Without his fast suturing, this surgery would have taken 5 hours.
Ethan, having you is a blessing for our department. Well done.
Chief Bell, you are too kind. It is my duty.
It is getting late. Let's call it a day.
Let's go.
The practitioner of the practice assistant in major surgery, XP plus 10%, current XP 100%, 100%, operating major surgery, assist perfect general medicine, XP plus 10%, current XP 100%, assistant in major surgery, XP plus 10%, current XP 100%, operating perfect general medicine, assistant in major surgery, XP plus 10%.
Perfect is a whole new level. So much medical knowledge at my fingertips.
Bonus reward, top tier limb reattachment.
That is a great skill. Now I am even more versatile.
Have you heard? Dr. Lane from Emergency, with his suturing skills, he cut the surgery time by 3 whole hours.
The whole hospital knows. With 1 sentence, he shut up. 2 chiefs. He must be good.
And he is super handsome. We have to bump into him. But I wonder, does he have a girlfriend?
Look! That's Dr. Lin!
He is handsome.
I missed him after lunch. We have to go check him out.
We've been resuscitating for over 30 minutes. Patient has no pulse or breathing. Brainstem reflexes are absent. We can issue the death certificate.
Then why the delay? Hurry up with the report. The insurance company just needs this document.
Alert patient is in suspended animation. Within 2 minutes, apply high-intensity stimulation. She might still be safe.
What is going on? Dead for half an hour. Still savable. This doctor is also Chief Bao's student, Dr. Sam Chung. I saw him on the doctor list. Dr. Chung, I think she is still alive. Can I give it a try?
Who are you? We don't know each other.
I am the new doctor in emergency. Ethan Lin.
You are the one with the amazing suturing, Ethan Lin?
Yes, Dr. Chung. I think she's still alive. Trust me. Let me try.
The patient has been down for 30 minutes. It is way past the legal time limit. Basically, there is no chance of survival.
Who the hell are you? Shut the hell up! The doctor already said. My wife is beyond saving. Who asked for your opinion? Get the hell out of here!
So eager for his wife to die. Something's fishy here.
Family members, calm down. If you keep this up, your wife will die.
Hey! Dr. Chang, what's going on? You just declared my wife dead. Send her to the morgue. I'm warning you, don't push me.
Is there any chance she'll survive? Let's not discuss that. For the family's attitude, you saw it. If this blows up, the whole ed, including the chief, will be implicated.
Dr. Chang, this patient can still be saved. I just need 30 seconds. If you really won't allow it, then I'll call the police and have an autopsy. Then we'll see who's responsible.
Autopsy? You, Ethan, are you crazy? This is the ed. Don't you think this is bad enough?
Dr. Chang, I am serious.
You!
This is your last chance. Get out after this!
Get the defibrillator.
Yeah.
Dr. Chong, what does this mean? You just said, my wife is dead. I am begging you, please don't torture her anymore.
Let him try.
Defibrillator and other equipment were taken out for backup and still on the way back.
Look, everyone! No equipment when we need it. As her family, I demand, let my wife go in peace. Stop torturing her. Is this request too much?
Just stop, doctor. We all saw it. You did your best. Give up now. No one will blame you.
Like the family said, let the girl go in peace.
How dare you say that? The doctors haven't given up yet, you. Her husband want to give up so easily. The woman in that bed, is she really your wife?
Get out!
It is the 13 gates acupuncture? Go. Get the silver needles and alcohol lamp.
Yes!
Acupuncture? Isn't that traditional Chinese medicine? Chinese medicine? Is this guy even reliable?
What's this?
Stay calm. Dr. Lin wants to help her. Just think. This is her last chance.
The 13 gates includes Philtrum, Thumb Tip, Hidden White, Great Mound, Spirit Pulse, Wind Mansion, Jawbone, Chin Center, Palace of Toil, Upper Stalk, Perineum, Crook Pool, and Sea Spring. Watch closely. I'll use 2 needles to seal her chest center and sea pillow.
What? Are you crazy? I don't know TCM, but I know these 2 points are vital points. One mistake, she dies instantly.
Exactly, you could kill her.
She's already dead. What's there to lose? Get ready. Everyone clear the bed.
Don't move. Hold her down. First, Philtrum to the Ghost Palace. Second, Thumb Tip to the Ghost Letter. Third, Hidden White to the Ghost Mound. Open the gate. Banish all evil. Seal.
What's he doing?
No idea.
No sinus rhythm.
Still nothing. That can't be. The system has never been wrong. 13 gates. I didn't make a mistake. Why no response? Could it be the monitor is faulty?
Now, I declare, patient Rainy Zhang in the emergency department at...
Wait, are you done yet? You are picking on me! I'll kill you!
Stop it, young man. She is gone.
He is a bit reckless, but his desire is understandable.
If all doctors were this dedicated, the doctor-patient tension wouldn't be this bad.
Exactly. You! How dare you touch her! I'll kill you! Ethan! Are you crazy? Get up now! Let go! Apologize to the family!
She's alive. She's really alive.
What did you say?
She's alive.
What? How is she alive?
It is the same as before.
The ECG shows nothing. How could she be alive? What the hell is going on? Is this guy crazy?
Central City Medical Center has such a stupid doctor. How can you tell? She's alive. Her heart.
Security! Get in here! Kick this guy out of the ward!
Dr. Cheng, wait!
Wait my ass. Believe you. Am I your pet? Kick him out.
Dr. Cheng, you!
Let him go! Let's see! Who dares touch my student?
Dr. Chen.
Why is Lucy here? I can't mess with her.
Dr. Chen! Forget about me. Look at the girl. In the bed. I've revived her. If we don't do CPR now, she might really die.
But the monitor already showed.
Dr. Chen, this monitor might have a short circuit. We need a new one. Then we can see her vitals.
Lucy, don't listen to his nonsense. We tried to save her for half an hour before calling it.
Exactly. He just shows up, saying she's alive, and does all these crazy things.
Exactly. Even if this goes to the chief, I'll never allow such an unreliable doctor to stay in the ad.
Enough of your nonsense. Sam Cheng, are you even a man? Hurry up, get a new monitor. We'll see if he's lying.
What?
Is this a ghost? No, impossible! It is impossible! My wife is dead! This is fake! I don't accept this!
Is Death on vacation? She has been dead this long, and they brought her back.
She came back. This girl, what did she do in her past life?
Sam, you do the compressions.
Practitioner, at the critical moments, save the patient from the brink of death. Experience increased by 10%. Practitioner, save the patient current, 10% need. 90 general medicine to master. Experience increased by 10%. Current 10%. Practitioner, save the patient. Experience plus 10%. Current 10%. Current 10% need. 90 more. General medicine to master. General medicine to master. Bonus, $300 cash.
She's back. I'm off duty now.
BP 7110s. HR 65. Patient has stabilized. Vitals are normal.
Alright, stop now. Her breathing and pulse, pupil response, all back to normal. She's just weak. She might wake tomorrow.
My wife is dead! She has been dead! Who told you to save her? Did you ask for my opinion? My wife must die today! Her being alive, for both of us, only brings us more suffering!
Security, escort the family out.
Wait a sec.
Listen to me! This isn't over! I'll sue you all!
Without the family's consent! You treated her! You're criminals! Criminals!
Everyone, leave. Patient needs rest.
Where's Ethan?
Ethan, this place is way too expensive. Let's go somewhere else.
Claire, don't worry. Your brother is now a doctor at Central City Medical Center. I get paid now.
But we can't just waste money. You still need to get married.
Once you're cured, I'll think about marriage.
Ethan, I am holding you back. My illness.
It is fine. Don't say that again. Just trust me. I'll cure you. Forget everything else. Today, let's celebrate. A new job. I'll save money from now on. Here, try this.
Your medical affairs, without knowing the whole story, come here to blame us. Is our Ed an easy target? Or do you think you can ignore me, the chief?
Chief Bell, calm down. I am just following protocol. The patient's family, specifically named, a doctor in your department, medical affairs, must investigate. As long as the evidence is clear, medical affairs will also ensure justice for our doctors.
That is more like what a doctor would say. If you'd said that, would I have gotten mad?
Ethan, you're here. Come on over. Just a patient's family making a fuss. Explain it briefly. This is Director Reed from Medical Affairs. Don't stress. Just tell the truth. In our ED, no one dares pressure you.
Dr. Lin, there is a man named Edward Young, a patient's family member, who claims you treated, without his consent, treated the patient, without consent, endangering her life. If the hospital doesn't resolve this, he'll report to the Health Bureau and even sue us. We need to know the whole truth.
Yesterday, I saved a young woman. Could he be her husband? I had a bad feeling yesterday. But this can't be right. Director Reed.
What's wrong?
Yesterday, after Dr. Chen called the time of death, I felt something was off. So I revived her. I saved her life. But her family didn't even say thank you. Instead, he's slandering me, falsely accusing me. Do you think, as her husband, this is how he should act?
What's going on? Dr. Chen, call time of death. Then Ethan revived her? Then the family sued Ethan. Meaning, without consent, he endangered her life. What the hell is this logic?
Director Reed, have you ever seen such a scum?
I didn't expect this, Ethan. Don't worry. The medical office will review the case and give you a fair resolution.
Chief, Rainey's husband Edward is burning paper money outside. He's filming and posting it online, claiming Dr. Lin murderer.
Is he done yet? I'll see for myself which bastard it is.
Get back here! If you go out now, you won't be heard. Emily, keep an eye on him.
Understood.
Dr. Fong, do you know Rainey's condition? I feel her husband doesn't want her alive.
No way. Rainey Zhang? She is not our patient, but I see her often. They're both young. They seem to get along well.
How about we go see Rainey?
Promise me. Just to see her. Until the chief resolves this. You must stay inside.
I promise. I promise, okay?
Let's go. Rainey, this is the one who saved you from death yesterday, Ethan, Dr. Lin. You have him to thank. If he hadn't insisted, you might have never woken up.
Thank you, Dr. Lin. But actually, you shouldn't have saved me. I am going to die anyway. It is not worth it to save me.
This isn't a normal reaction.
Rainey, you only live once. Don't give up. Even if your husband did something terrible, you have to think about your parents. If your parents saw you like this, how heartbroken they'd be.
I've let down my parents the most. I can't face calling them. Dr. Lin, when I die, will I go to hell?
It is okay. Crying helps. If you trust me, whenever you are upset, you can tell me. But I believe ... in this world. There are unfilial children, but never heartless parents.
It is like this. 5 years ago, at a friend's birthday party, Edward and I fell in love at first sight. But my parents opposed it. But for love, I made up my mind to cut ties with them. Edward and I got married before we registered. Through hard work, we bought a small house. But 6 months ago, I suddenly fainted. At the hospital, they found a heart tumor. When Edward found out, he was devastated. But as the medical bills piled up, he grew more and more distant.
So, he won't pay for your treatment. Is that right?
After he found out,
I had a large insurance policy. He completely changed. All he thinks about is the insurance payout and the inheritance. He came this morning and told me to end it all soon, saying it would set us both free.
How could such a monster exist? Rainy, wait right here. I'm going to find that bastard to sign. It's just a heart tumor. Others can't do it, but I, Ethan Lin, can. I'll save you.
They're killing patients here! Is there no one in charge? They're killing patients!
Rest assured.
Get lost!
Ethan, why are you out here? Get back inside. We're swamped in there. Can't you see what is going on?
Come on over! Check this out! This is Dr. Ethan Lin, the one responsible for this murder! He's put us, my wife and I, in endless suffering and darkness! If this isn't murder, what is? The patient's family is right here. Without the family's consent, you just treated the patient. Just for that, mark my words, I'll put you in jail.
No way! Without the family's consent, how could the doctor treat her? Who is responsible if something happens?
You sound so certain. Can't be all lies.
Murder, that can't be. Doctors here are mostly good.
Grandpa Lin, do me a favor. Give an old man some face. Go back inside, okay?
Don't worry, Chief. I am not here to cause trouble. I just need to ask this bastard one thing, then I'll go back. Edward Young, just one question. I am confident I can cure your wife's heart tumor. Just sign here, and I'll schedule her surgery. Will you sign it? Give me a straight answer.
Cure my wife completely! Get out of here! Impossible! We've been to all the top hospitals. So many heart experts and professors said her chance of survival is less than 10%.
Yesterday they said I couldn't save her, but I did. Now, I say I can cure her, and I will.
No, I can't let this happen. Brady must die. She has to die.
Sign it or not. Just say it.
Listen up, Ethan Lin. I won't sign anything. This video and everyone here can testify. If you dare treat my wife again, I swear I'll risk my life to take you down with me.
Are you sure?
I am not just sure. And let me tell you, Ed, I won't pay a single cent for Rainy's treatment. You better. Get her discharged now.
Young man, you are in the wrong here. The doctor said she can be saved, but you won't treat her. Are you forcing her to die?
Get lost.
Even animals aren't this heartless. What family would want a son-in-law like you? They must have done something terrible.
Mr. Young, if your family is really struggling and can't afford the treatment, the hospital has special aid programs I can help you apply to ease your financial burden.
I've heard about your situation. Apply for aid here. We'll help you cover some costs. For the rest, I can organize all Ed staff to make a donation. That should cover most of it.
Nonsense. You are all in this together, covering for each other. I don't care. I won't sign anything. Just you wait. I'll report this to the Health Bureau.
Move. Chief, check on the patient.
All right, everyone, disperse.
How is it? Did the family agree to sign?
Agree? Hell no. He wants Rainy to die now.
This is a problem. Rainy's husband won't sign. Rainy won't tell us how to reach her parents. Forget surgery. Even basic treatment can't proceed. If this continues, it won't work.
Dr. Fawn, why don't you have a talk with her? Get her parents to sign. Dr. Fawn is the Ed's people person. No one does it better.
Cut the sarcasm. But I can try. Wait for my work.
Ethan, come with me now. Emergency surgery.
Got it.
Dr. Chen, what is the patient's condition?
His toe is severed. Just examined him. Now let's talk to his family. Quick!
Okay.
We need to ask about his conditions.
Doctor, how is my husband?
Ma'am, his severed toe. We've examined it. Since it wasn't iced, carried properly, and not disinfected. It is in bad shape. But during surgery, we'll do our best to reattach his toe. However, this surgery has a low success rate. You need to be mentally prepared.
Please save him! You have to reattach his toe! He tills the land for us! Feeds our whole family! If he is disabled, my kids can't go to school, Doctor.
Ma'am! Please stand up.
Okay. Doctor!
Ma'am! This won't help. We can't diagnose him. To save his toe, you need to tell us how he got injured. That way, we can assess it accurately.
Today, while chopping hay, he slipped and the blade came down, cutting his foot, severing his toe. Doctor, please do something to reattach his toe. Oh, he is our only hope, Doctor.
Ma'am, we'll do our best.
Just got the limb reattachment skill. It is time to use it.
Thank you, Doctor.
Let's head back to the OR.
Please save him.
Please sit down.
Dr. Chen, local anesthetic administered.
Ethan, sterilize and debride the patient's toe, according to the patient. There might be hay debris, animal feces, etc. Must clean thoroughly to prevent infection.
Got it. Dr. Chen, the wound is badly infected. The blood vessels, nerves, tendons are all atrophied. Debride thoroughly. All these steps will take at least 10 minutes.
Understood. Let's finish debridement first.
Okay. Dr. Chen, debridement done.
Good.
Doctor. My toe. Can you reattach it? Also, how much would that cost? And if you can't, my kids are in school. I need the money for their tuition.
You have two options. First, we'll do our best to reattach your toe. But I have to be honest. For this reattachment, the success rate is very low. Also, after surgery, if infection or necrosis occurs, we'll have to amputate it. It is quite expensive, and you'll stay longer. Second, you give up reattachment, and we just suture the wound. This way, it costs less, and recovery is faster. However, you'll face permanent disability.
Doctor, thank you for being honest. I've decided. Go with the second option. Just bandage it. Don't reattach. Please, tell my wife that this is my decision. No one can change it.
All right.
Forget it. Just do it. Sir, trust me. I can make your foot as good as new.
Doctor, are you serious? My foot, can it really recover?
Very likely.
But my family...
I understand your concern. If the surgery succeeds, for your medical bills, I'll try to get them reduced. But if the surgery fails, and you need a second surgery, your hospital stay, including all treatment costs, I, Ethan Lin, will cover it. Will you trust me and give it a try?
Can it really recover?
I wouldn't say this. If I weren't absolutely sure, if you agree, I'll start the surgery. The sooner we operate, the better the recovery. If you end up disabled, you'll regret it for life.
Okay. I trust you, Doctor.
Dr. Lin, I don't think that is allowed. Without the lead surgeon being present, no one else can make the call. Maybe I should go find Dr. Chen and ask for permission.
Sir, do you trust my surgical skills?
Dr. Lin's suturing skills at Central City are second to none. Of course we trust you. We even asked the chief that all ed surgeries must have Dr. Lin do the suturing. But this surgery involves finger reattachment. It is more than just suturing.
If you trust my skills, then help me finish this surgery. If you don't trust me, then please stay quiet. Save your doubts. After the surgery, say what you want. Thank you, doctors.
It is my body. I can decide for myself. I am the one who asked this young doctor to operate on me. If anything happens, I take full responsibility.
Sir, please bear with me. I'll start now.
When will Dr. Chen be back? Please don't let anything go wrong.
Doctor, how is he?
Ma'am, please sit down. I am sorry to tell you. Your husband declined the reattachment.
Doctor, don't listen to him. He's just after the money. He'd do anything for it. If we lose money, we can earn more. If we lose him or he's disabled, he won't even have a chance to earn. That idiot, how can he not see this? Doctor.
Please calm down. It is not what you think. Let me explain. His condition first. The reattachment surgery has a success rate of less than 10%. As a doctor, considering your family's finances, I recommend give up on that less than 10% chance and just dress the wound. It will also reduce his suffering.
No! Doctor!
Ma'am, even a 10% chance, I'll sell everything. Borrow from everyone. You have to reattach his finger, doctor.
Ma'am! Please, doctor.
I promise. Please wait here. I'll go talk to him and discuss it.
I am just a woman with no skills. Please save him. I am begging you.
Okay.
Thank you, doctor.
Bandaging done. All done. Thank you for your cooperation. Move the patient to the recovery room. After observation, transfer to the general ward.
You're too kind. Dr. Lin's technique is always a sight to behold.
It is our duty. For Dr. Lin's surgeries, we'll follow without question. The best thing the Ed ever did was hire Dr. Lin, an expert like you. While I was away, you dared to do the bandaging.
Dr. Chen,
Save it! It is done! Sir, I have some bad news. I need to tell you. Please stay calm. We'll figure this out together.
Go ahead, doctor. I can handle it.
Your wife refuses to agree to the bandaging. You have to call her and tell her it's already done. I can't explain to your wife.
Without family consent, Ethan finished bandaging. How am I supposed to explain?
Doctor. My wife worries too much. Don't mind her. My foot is already healed. When we get to the ward, I'll talk to her.
You'd better tell her. If she asks, just say it was me. I'll go. I am Lucy Chen. I decided against reattaching your toe. I was the lead surgeon for this operation. I'll take full responsibility.
Dr. Chen, you...
Responsibility? Dr. Chen. What responsibility? I heard hospitals are bad, but not this bad. I can tell you're in charge here. But you're so brazen taking Dr. Lin's credit. I won't stand for it.
Taking credit?
You couldn't reattach it. I don't blame you. After all, every doctor has their own specialty, but Dr. Lin is skilled. He reattached my toe. You can't be so jealous to steal credit.
What? You performed the toe reattachment!
Dr. Chen.
Ethan Lin, how dare you? I thought you were just bandaging him while I was away. You did a toe reattachment. Tell me the truth. For the toe reattachment, what is the survival rate?
100%. And after the surgery, blood vessels, nerves, tendons, all checked out perfectly.
Dr. Lin is right. It was a perfect limb reattachment.
Yes, Dr. Lin's skills amazed us all. Fine. I'll talk to the family. Wait for me in my office.
Practitioner completed surgery. Experience plus 30%. Current 40%. Need 60% more. Need 60% more experience. General medicine upgraded to master. General medicine. Master.
You studied general medicine, and they taught you reattachment.
General medicine doesn't cover this. But my mentor, Professor Cole, when he was researching this technique, I got to observe. Professor Cole, sorry, but you are taking the fall.
Just observed it, and you dared to do it. And it is perfect. Even Professor Cole himself couldn't do better.
Maybe I am just talented. Dr. Chen, besides toe reattachment actually, I know almost everything else. You know, I studied general medicine.
You're full of yourself. Who gave you the right to do the reattachment? Without the lead surgeon's approval, you dared to do it. If something goes wrong, can you take the blame?
Dr. Chen, it was an emergency. I feared delaying treatment, so I didn't have time to report.
Rules are rules. If all doctors act like you, the hospital would be chaos. I am doing this for you, and for our whole team. Next time, think it through before acting.
Understood.
Alright, go find Emily Fawn. Continue triage at the desk.
Okay.
How does he know everything, and so well?
I was worried sick. You're finally back. I've already contacted Rainey's parents. When they heard what happened, they left home right away and are rushing to our hospital. They also said they'll sign the consent so we can prep for surgery.
Dr. Fawn is amazing. You got it done so fast. The sooner the surgery, the sooner Rainey can get back to normal.
Now the patient is fine, but the doctor is causing trouble. Rainey Zhang is Dr. Cheng's patient. He won't hand her over. To us, he said. It is the chief's order.
Let's go. We're going to get the patient back.
Easy there.
Chief Bell, I'm the one who saved Rainey from the brink. Dr. Cheng is hoarding her. Not even letting me operate. Isn't that going too far?
Going too far? That was my call. I told Sam Cheng to keep you away from Rainey's case.
That's not right, Chief. Why can't I operate on Rainey? I'm confident I can cure her.
You should know it's not your patient, so don't meddle. The Health Bureau just called. Edward has reported you, saying you practiced medicine without consent. I didn't suspend you. That's already lenient. Go home and rest. Await the result.
No way. I insist. I want to be the one to operate on Rainey.
I am done talking. You are on leave. Go home and rest. When you figure it out, you can come back.
What about Rainey?
I'll handle Rainey personally. Once you're cleared, you can join the surgery.
What if I refuse? What if I refuse?
You refuse? So what? Do you think you can defy me?
Ethan, you should go back now. The chief made it clear. Wait until the investigation ends, then operate on Rainey. It is not too late. Don't worry. I'll take care of Rainey myself. Before her surgery, I won't let anything happen to her.
First and foremost, protect yourself. Now, you've been reported. If you act rashly, you might even lose your license. Then, how can you treat patients?
If I can prove Edward Young's status is illegal, then his report won't hold water. Right. How could I forget this?
What is with you? What are you doing?
Chief, if I can resolve the complaint right away, you won't find any more excuses to stop me from operating on Rainey.
The Health Bureau has opened a case. You kid. You say you can fix it. And you can.
How did you confirm Edward's family status? Don't tell me. He just said so. And you believed him. If he isn't, then his report to the Bureau would be invalid.
Hold on. Their relationship is confirmed. If not family, what are they? Why wouldn't I believe it? This is how we always confirm family.
No marriage certificate, no direct authorization. Edward claims to be her husband. You just take his word. What if during treatment something goes wrong, and her parents come to make trouble, and we find out Edward and Rainey aren't even married? In that case, can the hospital be innocent? Besides, her parents, would they listen to your explanation?
Chief, you know, this scenario could really happen. Rainey's emergency yesterday. If we'd listened to Edward and given up, Rainey's parents, when they find out, they won't let us off the hook.
They have a point. If that happens, it'll be worse.
Edward Young's family status cannot be verified by our hospital. Whether he admits it or not, it doesn't matter. As long as we have her written consent, and she designates her parents as signatories. Whether Edward is family or not, our treatment process has nothing to do with him. In other words, any complaint he files is baseless.
Chief, I've talked to Rainey very thoroughly. She hates Edward now. She clearly said she never wants to see him again. She designated her parents as her signatories. It is all set. Once I print the documents, she'll sign them right away.
Chief, look at this.
What are you looking at? I think you should be the chief.
Chief, why are you getting worked up?
You two talk too much. Go get the patient's consent. What are you doing here?
All right. I'll get the patient's signature now.
Once you get the signature, have Lucy bring the patient over for surgery. I am coming too.
All right.
Prepare to send the patient to war. I'll notify the chief.
It is is Rainey's parents. They're flying in from abroad. They want us to fax the documents and schedule surgery. Go to the OR first.
All right, I am on it.
Do as I said. For this surgery, we're racing against time. I bet. The Health Bureau is already here.
We're not afraid. Let them come.
Let's go.
The whole story is like this. Ethan Lin didn't get the family's consent. Operated on the patient without consent. The patient's husband, Edward Young, reported this to the Health Bureau.
Today, the purpose of this meeting is to brainstorm together and come up with a perfect solution, defend the hospital, and speak up for our doctors. Chief White, you go first. Your department often deals with such tricky disputes. Chief White is an expert at this.
In my department, if something like this happens, not notifying the family and treating the patient without consent, we fire them on the spot.
Wasn't it an emergency? The patient's life was at stake. If Ethan had followed protocol, he might not have been able to save the patient.
Even in an emergency, he can't violate the standard protocol. If all doctors do this, wouldn't it be chaos?
I agree with Chief White. Doctors like Ethan are arrogant and reckless. He's a black sheep. Kick him out now!
Ethan Lin resuscitated a patient who was declared dead. Such a brilliant doctor fired for violating a simple protocol. What will other doctors think?
I disagree. He saved the patient, yet the family is still suing. We can't encourage such bad behavior. If we fire Ethan, who will dare to act?
Listen up! Ethan Lin must be fired today, or I won't let this go. Listen up! I was right here. My wife's surgery, and no one told me. Is this a joke? The Health Bureau Director is here. How dare you act like this?
Are you Rainey Zhang's family member, Mr. Young?
Of course. Listen up. I am the husband of Rainey Zhang. During her stay, the only one authorized to make decisions on her behalf. Ethan didn't even tell me, and operated on my wife. How ridiculous is that? You must give me an explanation.
This is outrageous. We're still in the meeting, and he dares to operate on the patient.
Where is Chief Bell? Could it be Chief Bell and Ethan are in surgery?
Stop arguing. Follow me to the OR.
Ethan, are you sure? Rainey's surgery is more complex than we thought.
No problem. As long as the heart has no organic damage, I am confident she'll make a full recovery.
All right, start the surgery. Scalpel. Retractor.
Alert! Chest spread must not exceed 5 centimeters. cm. Otherwise, the tumor must not exceed 5 centimeters. May rupture. Otherwise, the tumor may rupture.
Stop!
Dr. Chen, the chest spread should not exceed 5 centimeters. Otherwise, the tumor on the heart could rupture at any moment.
What? Only 5 centimeter? With such a narrow spread, the surgery is impossible. Ethan, what's the basis for your judgment? Besides, the tumor on the heart is huge. Without enough exposure, the resection and suturing will be extremely difficult.
Chief Bell, it is from experience.
What a little brat, he warned me. Experience is dangerous. Now he says it is from experience. What a load of crap.
I did a surgery, just like this with my mentor. Exactly the same. Professor Cole, sorry, you'll have to take the blame.
So you and Professor Cole did a similar surgery. With only 5 centimeters exposure, it'll be extremely difficult. It is several times harder, and it'll take much longer. Are you two confident to do this?
No problem. Whether it is 5 centimeters or 10 centimeters exposure, it doesn't make much difference to me.
Removing the tumor is no problem for me. It might take 2 more minutes. Not sure if Ethan can finish the suturing.
Dr. Chen, no rush. Even if it takes a few more minutes, I'll make up for it.
All right. You two get ready. I'll go get the parents to sign the consent.
Supervisor Carter! Look! They operated on my wife! Without my consent! Is this a joke? I'll sue them! Make them pay!
You are making a scene. So many people.
Dean Carter, during surgery, an emergency occurred. The critical notice was signed by fax.
All right.
No way! He has no right to sign for my wife!
Why are you here?
Why can't I be? I am Rainey's husband. legally her primary heir? Do you understand? Even for consent, I am the first in line. So what? They never counted. Even less now.
You idiot! Can you talk sense? Your wife is here. Our doctors saved her life. You say nothing but pick a fight? I'll knock you out!
I really want to hit you! Come on! Hit me here! Move!
Just to try it, I am looking for someone to cover my medical bills.
Look at you! Oh my god.
What's going on? She's in critical condition. How can you be fooling around? Do you want her to die?
Chief Bell, what exactly is going on inside?
We were confident in the surgery plan, but unexpectedly, after opening the chest, we encountered unforeseen problems. Originally a 10 centimeters incision, now only 5 centimeters. Given the patient's potential risks, we have to get the family's consent.
5 centimeters surgical field. Then this surgery is basically impossible. No one can work in such a narrow field and finish in 10 minutes. Instead of chasing impossible odds, let her live a few more years.
Chief White is a pro.
I know Rainey's condition very well. I led the emergency consultation myself. Because we couldn't do the surgery, we decided not to admit her.
Can we do it or not? I need a straight answer.
Chief White, shut up! You want to make it worse? Dean Carter, I wasn't finished. Rainey Zhang faces challenges, but I have faith Dr. Chen and I are confident we can do this. Besides, we've already got her parents to sign the consent. We can start the surgery now.
Chief Bell, your reckless guarantee will only drag the hospital down with you. I dare say, not just here, even the top heart hospitals can't do this. This surgery.
Chief White, mind your words. This is my Ed surgery.
Charles, be honest with me. What is the chance this will work?
Dean Carter, I am at least 80% sure.
All right. Start now. Don't waste the golden hour.
No! No way! I am Rainey's primary heir. Rainey's surgery is my call. Besides, this chief said, no one can do this surgery. Instead of dying on the table, let her live a few more days.
Move! It is useless. You, take a look. Who do you think you are?
What's this?
No way! How could you decide this? Didn't they cut ties with Rainey long ago?
When Rainey and I were struggling, where were they?
Your doubt is useless. This was signed under our supervision. It is legally binding.
Doctor!
Let me ask you one last thing. Does Rainey have a will?
She's alive and well. Why a will? Are you crazy?
No will. Perfect. I am still Rainey's primary heir. House, insurance, it is all mine. Even the chief couldn't do it. Rainey's surgery, Ethan can't do it either.
Let's wait. Since Lucy is so confident, she must have learned new techniques.
Dean, Rainey's condition and I, with my senior at Metro Heart, have studied it. With current tech, almost no one can remove her tumor.
We'll just have to wait.
Finally done. Well done.
We did it! We did it!
Practitioner completed full surgery procedure. Experience plus 20%. Current, 60%. Need 40% more. General medicine, master level. Bonus $15,000.
Didn't expect such a big cash bonus.
It is my fault. I tried my best, but when removing the tumor, I was 3 minutes late.
What a shame for such a young girl. Lucy Chen, as a doctor, you don't know your limits. Look now. This is a total malpractice.
Everyone. The surgery was a success.
What? What? The surgery was successful.
That is impossible. Absolutely impossible. It can't be done. There are no precedents. It worked. How is that possible?
Believe it or not, it was a success.
Chief Bell, 5 centimeters surgical field. Such a huge tumor. In such short time, resection and suturing, even the father of surgery. If Hua Tuo were alive, he wouldn't dare claim this.
Exactly. That is incredible.
You just closed the chest, didn't you? Yes. That is the only way it makes sense. Chief Bell, for the sake of your petty pride, you dare fake a surgery. Must I expose you in public?
If you don't believe it, check for yourselves.
Lucy, Ethan, Emily, back to our department.
Alright, let's disperse everyone. Leave. Supervisor Carter, you saw it all. Parents signed consent. Does his report still count?
Well, of course not. Dean Carter, I sincerely apologize. We came without proper investigation. Sorry about this.
Ethan, just you wait. I'll kill you one day. Ethan, just you wait. I won't let you off easy.
I feel the way Edward looked at you was unsettling.
Ethan, Emily, incoming patient. Prepare for resuscitation. Got it. You handle this one. I'll take the other. Sure.
This patient suffered a heavy impact and secondary injuries. His feet were severed by a sharp object, and the inner thighs are all lacerated. His scrotum, his testicles are completely severed. We need to stop the bleeding now.
Oh, hell! Why is karma hitting me so fast?
Doctor, what is going on? Why is it so serious?
200 meters from the hospital. A truck. Driver was drunk and lost control, hitting these two. His injuries are minor. Look at the other one. Almost cut in half by glass. Luckily, our ambulance passed by and brought them straight here. Otherwise, these two wouldn't have survived.
Okay, understood. The patient's in your hands. Hope you'll do your best to save him. I'll get going.
Oh, doctor, I am begging you. Please stop the pain. I can't take it.
Normally, to ease the patient's pain, we would definitely give painkillers. But you're different. You value procedure and legal protocol. Without family consent, we can't prescribe meds. Just bear with the pain. It won't kill you. Once your family signs, we'll discuss the costs.
It's you! You're getting revenge!
Come on, hit me.
Dr. Lin, I am begging you. I'm an animal. I'm not human. Just let it go. Please, just stop the pain. Otherwise, I'm really dying.
Ethan, come to the ER for a consult.
Sure, on my way. You guys, keep an eye on him. Without family consent, no one treats him.
Yes, Dr. Lin, understood.
The patient's condition is critical. I've called general surgery, radiology, and all department chiefs for a consultation. Before they arrive, let's work internally to draft a treatment plan.
She's our team's patient. Let me go over her condition. Patient Sophie Lee, 22 years old, junior in college. Flying shards of glass severed her lower body, almost completely at the thigh.
That's critical.
Due to the speed, this level of limb reattachment has never been successful. Due to arterial damage, she has lost too much blood. Her life is in critical danger. In this case, our only option is an amputation. Even if the surgery succeeds, and she survives the post-op infection, her prognosis is still grim.
Ethan, you brief us on the male patient.
Patient Edward Young. That is right. Edward Young, Rainey Zhang's husband. The one who burned paper money in the air lobby and threatened me to hurt my patient's family.
Serves him right. Karma's a bitch. God is fair. Not yet, but it is coming.
Look at this bastard now. Who is gonna save him?
Any family? Without family consent, don't dare treat him.
Watch your language. Everyone in our ER beds is our patients. Respect patients is the basic code of our profession.
That little bastard. How is the male patient?
Both feet severed. Extensive lacerations to both thighs. Entire scrotum severed. However, he got here in time. He is basically fine. Can be reattached.
Damn.
They say if you do too much evil, your son will be born without an anus. He can't have kids now.
How evil must he be for God to take away even that chance?
Eastland's last eunuch. It suits him, the venomous bastard.
Quiet down, Ethan. You mean you can reattach Edward's feet?
Feet or balls? Reattaching them isn't complicated. Won't take long. However, me operate on that little bastard. No way in hell.
Ethan, watch your mouth. As a person, it is normal to have likes and dislikes. But as a doctor, you must set aside your feelings. See only the patient. No good or bad. Since you say you are capable, perform Edward's surgery. Then whether you like it or not, you must do this surgery. Do everything you can to finish this surgery.
Impossible. First, without the family's consent, I'd advise everyone not to take Edward's case, this surgery. Second, Sophie's injury could be life-threatening. Compared to Edward, I should prioritize Sophie's surgery.
Nonsense. If you keep this up as your direct superior, I can suspend you.
Hold on. Let me think. Ethan said he can fully reattach Edward's feet and his balls perfectly. Do you believe him?
Ethan did a similar surgery. For limb reattachment, I am afraid even Chief Hughes can't match him. That surgery, I wasn't even 10% sure. Not at all. Even if Chief Hughes did it himself. From what I know, I am afraid he is only 10% more confident. So I believe Ethan can do it. He can do the surgery. But this guy, Chief, can you talk to him?
Ethan, be honest. You made it clear. You won't operate on Edward because Sophie needs surgery now. Operate on Sophie immediately. So you mean you're confident after Sophie's amputation, you can prevent post-op infection?
Amputation? I am confident she'll be up and running.
Ethan, I must remind you again. It is a complete leg amputation, not a simple fracture. In this case, no one would dare guarantee a full recovery.
I know it is not a fracture. What I mean is, I should perform limb reattachment surgery, so the patient and walk again. I am a master at limb reattachment.
Ethan, are you serious?
Could it be he has seen Professor Cole do it, so he is so confident? But if it is such a groundbreaking surgery, even one case would shake the whole industry. Never heard of it.
I promise. If I fail Sophie's surgery, I'll leave Central City Medical Center.
You and Lucy get ready. Sophie Lee needs emergency surgery. Edward Young, you don't have to worry. General surgery will handle it.
Chief Hughes, if this continues, we'll be in trouble. Now patients all go to emergency for surgery. Then what is the point of our specialized departments?
It is time to put emergency in their place. Since the hospital renovation, an emergency got their own, or that old man Charles Bell is getting too cocky.
Chief Bell from emergency needs our urgent help. He said there are 2 limb reattachment cases needing our help.
Chief Hughes, let's go check it out. Let's go.
I am completely lucid! I am fully responsible for my words. Please, Chief Hughes, operate on me now. No matter what happens, I promise I won't blame you. But this violates the hospital's protocols. Given your condition, you'll need general anesthesia if something goes wrong. Without family consent, won't that be worse? How about I talk to your wife again? Please, Chief Hughes, don't go to Rainey. We've already split up. She won't sign for me.
Chief Hughes, we're running out of time. Let's get the patient over there. Just a family signature, right? I'll go to the medical office and handle it.
Then the patient's signature is in your hands, Chief White. I'll sign right away. Once the patient is back, I'll start the surgery.
Thank you, Doctor, thank you.
Chief, I have a feeling general surgery is in for big trouble.
Don't worry. If anything happens, it is his bad luck. All right. Get ready. Come with me.
Yes.
For this surgery, Ethan is lead. Lucy, you're first assist. I'll be second.
Resident leading, attending and chief assisting. First time ever.
The chief really trusts Dr. Lin a lot.
I've seen Dr. Lin do reattachments.
He has got this.
I am sure general surgery has started. Edward's surgery. Let's hurry up. Don't fall behind. Let's start.
Congratulations! Chief, his feet are fully reattached. If recovery goes well with crutches, he might walk again. Such a complex reattachment surgery has a 30% success rate. Chief Hughes is the best in reattachment in our province.
All right. Focus, everyone. Let's proceed. The lower body injury. I, Nick Hughes. Now that I am leading this surgery, it must be perfect.
Bad news. Chief, we can't reattach the lower body.
Move. You've been my assistant for so long, yet you are still so impulsive. It is tricky. If it was just the severed part, reattachment is simple. But now, this glass has severed his lower body from the inside. We have to amputate it. Otherwise, post-op infection could kill him.
Chief, if we do this, you have a hole there. You have to squat to pee. Should we get the family for consent? After all, he's a man.
Family consent. Change the outcome? Or do you have a better plan?
Chief, how dare I question you? I just want to be safe.
Start the surgery. Don't worry about the consent. Chief White will handle it.
Congratulations on your first surgical lead experience, plus 30%. General medicine, master. Current XP, 90%. 10% more XP to master. In general medicine.
Perfect. Just 10% more, and I can cure Claire.
Bonus, $3,000 cash.
Now, we can announce to the public. Sophie Lee's surgery is a success.
Perfect. Looks like general surgery. Just got schooled. Let's see if Chief Hughes keeps his word this time.
Bad news. Chief, emergency announced. Sophie Lee's limb reattachment is a success. If recovery goes well, she'll be able to live a normal life.
Impossible. Charles Bell must be crazy to joke about a patient's condition. 3 hours. Even if they manage to amputate and suture the stump, that's already impressive. They must be twisting the facts, calling an amputation a reattachment.
Go now. Spread the word about emergency, twisting the facts. I want every doctor at this hospital to see Charles Bell for the liar he is. You know what to say?
Yes, Chief.
The success rate of reattachment is clearly stated in surgical textbooks. Also, release a statement that general surgery reattached Edward Young's feet. His feet survival rate should be 100%.
Got it.
Claire, you are not well. Don't cook so much. Next time when I get back, I'll take you out.
Ethan, I am feeling much better. It is expensive, too greasy. You know I need light food.
Light doesn't mean tasteless.
These are nutritious. Come on, hurry. Go wash your hands. Dinner's ready.
Just one more surgery, and Claire will be cured. Hurry.
Go.
All right. Almost done.
Just a sec. Ethan. These two are from the insurance company, about Rainey Zhang's policy. They'd like to ask you some questions.
Dr. Lin.
Hello.
I'm Jack Kingston, from New Horizon Insurance, claims supervisor. We're here today to look into our client Rainey Zhang passed away in an accident. May we have a moment?
Wait a sec. Rainey Zhang passed away. Rainey Zhang is dead. The Rainey Zhang you mean couldn't be the one admitted here, right? I operated on her yesterday. She is young, recovering fast. She should be discharged in less than 2 weeks. Who told you? She is dead. This is absurd.
Our subject is Rainey Zhang admitted here. Her husband, Edward Young, reported to us, claiming his wife is dead.
But how is she alive?
Do you have a death certificate? How can you say she is dead?
We asked the beneficiary, Edward Young, to provide the death certificate, but he failed to do so. Since yesterday, we can't reach Edward Young
given the huge insurance payout, we came to the hospital early to investigate. Dr. Lin, could you tell us more about Rainey's condition? It is crucial for our case.
Isn't this obviously insurance fraud?
It is clearly insurance fraud. Listen up. That day Edward just pounced and pulled. It was like this.
What? There are such monsters. For insurance fraud, he forced his wife to die without a grave.
Dr. Lin, we've basically confirmed that Edward Young committed insurance fraud or even tried to murder his wife. After our investigation, the relevant materials will be immediately submitted to the police. Such a monster must face the full force of the law.
Oh, right. Edward broke his legs and groin. From what I know, he should be in our general surgery, receiving treatment. Barring any surprises, he won't be, leaving the hospital anytime soon. If you're going to report this, you'd better hurry.
Karma's a bitch, huh?
Of course. He brought this on himself.
Alright, we got it.
Dr. Chen, how's Edward doing?
The group chat says his reattachment surgery is done. 100% success rate.
What about his groin?
He didn't say.
Dr. Chen, if I'm not mistaken, Edward's surgery failed. Looks like Edward is about to give Chief Hughes hell.
His uncles! They're all his uncles. High tables, low stools, they're all wood.
There's some bad news I have to tell you. Please stay calm.
What do you mean, Chief? You personally told me after surgery it was a success. You said, I'd definitely walk again. Now you are saying there's a problem.
Your legs have developed massive necrosis. We need to amputate them. Otherwise, your life is at risk. You have to trust us. The treatment plan is the best possible option.
The very best! Go to hell! Hughes! What did you say yesterday? You said exaggerated. The girl who came in with me. You said she'd need an amputation and might not survive. You said my legs were saved. It was already the best outcome. Now you're saying this? Listen up. Don't think I don't know. Listen up. Don't think I don't know. The whole hospital's talking about it. Emergency did. That girl from yesterday. A very successful reattachment. She's back to normal. She's up and running. My foot, you didn't fix it. And now you want to cut it off? You crippled me. Are you even human?
We did our best. But the success rate is very low. We didn't want this to happen.
Wait, Chief Hughes. Yesterday morning in ER, there was a patient, foot reattachment. Both his feet were cut off by a hay cutter. Hours late, but a doctor named. Oh, right. Dr. Ethan Lin reattached them in no time. He said she could go home in 10 days.
Impossible. Absolutely impossible. Every hour delayed, the chance of reattachment drops by at least 10%. Not just here. Even the best surgery hospitals. Reattaching the feet is almost impossible.
She is in the ER ward. Don't believe it. Go see for yourself. Why the rush, Dr. Lin? Reattached a girl's leg. He fixed it. Reattaching a foot is nothing to him.
Did you hear that?
Buddy, if you want to save your foot, get to emergency now. Go find Dr. Lin. Maybe he can fix it. If you stay here, you might lose your life.
Edward, he's just bragging. There's no way reattachment skills. Besides, it was done by a new guy like Ethan. Impossible.
Go! Hughes! I don't want to waste any words. Right now, transfer me to ER. Did you hear? Or else.
Absolutely not. The transfer and surgery, we're approved by you. for the patient's sake. Until he fully recovers, we can't let him go. I approve that! When did I approve it? I approved it! You crippled me! What a load of crap! Oh, the signature! Right? Go get me the dean! I'll show him how you surgeons operated on me without my family's consent. You operated on me and crippled me. You are playing with lives.
What goes around comes around. Chief Hughes, your storm is coming.
I'll get Chief White for the signature. Oh! Hurry!
Chief Hughes.
Chief White, get me Edward Young's surgical consent. That bastard, what a total idiot. He just flipped on me.
Consent? What consent? Don't mess with me.
White, you didn't forget, did you? When we took Edward from the ER yesterday, you said you'd handle the consent forms with medical affairs.
Oh, that consent. Weren't you bragging all over the hospital about how your limb reattachment surgery was a huge success? Since the surgery was a success, the patient is grateful to you. Why do you need consent? With such a success, I didn't go to medical affairs for consent.
You!
Don't tell me. Edward Young backed out again? He is upset you cured him. Now he is giving you trouble.
You?
What can I say about you? Edward Young's reattachment failed completely. Massive infection and necrosis. He now needs amputation surgery. About removing his lower body. I haven't told him yet. Look, Chief White, you have more clout here. Come with me now to Edward's room. Please explain it to him. He won't listen to anything I say.
No family consent. But when we operated on Edward Young, he signed it himself.
Right, right!
Okay, let's go. You be the bad cop, I'll be the good one. If all else fails, we'll find some sponsorship to cover his costs.
Okay, let's go.
Chief, could you let me do any other surgeries?
We don't have that many surgeries.
Chief, help me out here.
General surgery is busy. But you know, Chief Hughes won't share.
Chief, I just passed their ward. Edward's surgery failed. He's confronting Chief Hughes.
Really?
That's our chance. I'll get Dean Carter. Let's go. Steal him.
All right.
What is going on? Chief Hughes, what are you doing? The whole hospital is in an uproar, talking about your department.
It is not my fault, Dean. I've never seen such a weird patient. This patient, Edward Young. Oh, right. Dean, you know him. He made a scene in the Ed yesterday. That unreasonable guy. The patient's family.
Chief Hughes, that is not right. I remember at yesterday's meeting, when discussing Ethan's case, you and Chief White agreed with Edward's claims. You were defending him. Now that he is in your department, he is suddenly an unreasonable man.
Wasn't I? Blinded by them yesterday. We used the best techniques to reattach Edward's feet. But Dean, you know, limb reattachment success rate is extremely low. The surgery failed. We had to amputate his legs. It is just standard procedure. But this patient doesn't understand and is making a scene.
You are all in this together. Not a single word of truth. Dean, I was fine. He turned me into a cripple. How dare he, Dean? You have to help me. Our hospital reattached Sophie's legs after they were severed. You can't give up on my legs.
Hold on. What did you say? Ethan reattached the legs of Sophie Lee, who was cut in half.
Impossible. Dean, they must have done an amputation. Ethan Lin, that young guy who barely operates. How could he possibly pull off such a surgery? If he can do surgery like this, then all of us, in general surgery, might as well jump in the river.
Who said it is impossible? Yesterday, Ethan was lead surgeon and completed Sophie Lee's limb reattachment surgery, and it was a success.
That's impossible.
That is impossible. His torso was completely severed. There is no precedent for this.
Dean Carter! They must be lying. Do you think this is possible?
Who are you kidding? The whole hospital knows it. Are you still doubting it? Dean Carter, I demand Dr. Lin operate on me now, or else I'll sue you all. Just you wait.
Chief Hughes, Chief White, if you two still don't believe it, you can go next door to Sophie Lee's room. Or else, check this morning's hospital bulletin.
This...
Emergency department, that is amazing. They really reattached it.
I demand. Transfer me to emergency now, quickly, now!
Chief Hughes, Chief White, you heard. The patient's demand. Dr. Lin is here. What's next? I don't need to say more.
Well, Chief Bell, do you think we could transfer Edward back to your Ed? Even limb reattachment. Such a tough challenge. The Ed has conquered. Reattaching Edward's 2 feet should be a breeze. Well, it depends on Dr. Lin. Dr. Lin, could you take him back to Ed? And personally operate on him?
Chief Hughes, I am afraid I can't accept your request. I treat humans, but I don't treat bitches.
Hey, Ethan, who are you calling a bitch? Is this the quality of your hospital? Is this how you treat patients?
So what if I did? You did it, so don't be afraid of it getting out. Listen up, you piece of trash. Don't ever dream of me healing your feet.
Dean Carter, this is the doctor our hospital trained. What a disgrace. I demand. Dr. Ethan Lin, operate on me now, or else this isn't over.
Move aside. Police.
Move aside. Police. Edward Young, you're suspected of insurance fraud and attempted murder. 2 charges. You are now under arrest. Stop resisting. Cooperate with us.
Officer, there must be a mistake. Insurance fraud. I have no idea what you are talking about.
We have Rainey Zhang's and her parents' testimony. You are charged with fraud and attempted murder. With both charges, you won't see the sun outside for 10 years. Take him away.
Hey, officer! Wait a sec! Listen to me! When you arrest someone, don't you have to ensure their basic rights? My leg can't wait any longer. I need surgery now. Even if you arrest a killer, you still have to ensure their basic rights.
Don't worry. Given your condition, we'll transfer you to a police hospital for treatment until you're fully recovered. Then you'll be imprisoned. Go.
No!
Ethan Lin, listen up. I won't let you get away with this. When my leg grows back, I'll come back for you. I'll be back.
He finally got what he deserved.
Ethan, if it were someone else in this condition, can you operate on him?
It has been too long. It is impossible.
You two! Learn from the ER. What a mess you two made.
Ethan, Chief, we got a patient with acute appendicitis. Go check on him.
Chief, quick.
Emergency surgery. No need to go to general surgery, Ethan. You can lead on this appendectomy.
Got it. Let's go.
Ethan, you are getting better at this. The surgery was a success. And it took half the time. Dr. Lin, amazing.
Appendectomy completed. Experience plus 10%. Current EGSP, 100%. General medicine instantly upgraded to master.
I can feel it. Powerful medical skills flowing into my mind. The system didn't lie. Claire's disease is curable. Dr. Chen, Dr. Fong, I am bringing my sister in. She needs surgery. Please get ready. I'll bring her over.
Sure.
What is wrong with Ethan's sister?
He mentioned it. I think it is dilated cardiomyopathy.
That disease is incurable. Could it be Dr. Lin found a new treatment method?
Ethan, what is the rush?
Claire, come with me to the hospital. I found a way to cure you. Let's go. The surgery
was a success. It worked. Ethan, you'll be a medical legend. He cured this disease. I can't believe it. It is a medical miracle.
Thank you, system.
Ethan, Chief Bao, Dr. Chen, Emily, you are all here.
It is your discharge day. We wouldn't miss it.
You're the first dilated cardiomyopathy patient cured. It's a medical miracle. We had to come see you.
Even though you are cured in your daily life, you still need to be careful.
Thank you, Chief. Thank you, Dr. Chen. I'll be careful.
Here, Claire, these are for you. Come on, let's cheer together. Congratulations to the first, patient Claire Lin, on her discharge.
Yeah.
Why aren't you cheering?
Yeah.